Let's talk about the situation now with the Deputy Health Minister, Dr. Sibongiseni Dhlomo. Dr. Dhlomo, very good evening to you. Grateful for your time. Let's start first with these 4 deaths, which the department is now saying are linked to the ongoing Nehawu strike. How do you make that link?
We will be having a meeting in an hour's time with all the provincial MECs. I am not able to comment on that part because you're right. We need to have a dissection. All that came up today. So can we give that part some time to look into it? At 7 o'clock, we will be converging under the leadership of the minister with all other provincial MECs, and then maybe we can interrogate that part. I can't be able to express that right now, especially that aspect we are raising now.
I appreciate that, Dr. Dhlomo, but it's something that the health minister has already put out there twice on the visit to Charlotte Maxeke Academic Hospital last night and again this morning at the briefing, talking about deaths which could be directly attributed or attributed directly to the strike. Should the link not have been drawn before the department went public with such a comment?
But Tembegile, you are saying it already yourself. It could be related to, not confirmed. So why don't you give us time to interrogate that? Because we are monitoring the strike all over the country. I happen to be in the Western Cape. The minister was speaking in Gauteng, and it says could be. Why don't I really err on the side of waiting for us to confirm and talk about it collectively as a leadership at 7 o'clock tonight? Just that aspect of the deaths. Could be or could not be. Let's wait for that part.
But I'd imagine the department would have done some groundwork, established a few facts which lead it to believe that they could be linked. That's what I'm trying to figure out, what it is that happened in those 4 cases that suggests that there may very well be a link, even if it's not confirmed.
Then I might as well apologize. My understanding of English is not the same. Could be linked. Could be. So it means that person is presupposing that, can I establish this further and confirm that it is, rather than say could be. That's what I actually say. Give us that space to say could be linked, to change it to be it is linked or it is not linked.
And I'm asking you, Dr. Dhlomo, on the basis of could be linked, what it is about those 4 cases in particular that requires investigation, let's say, that is different to many other deaths which unfortunately happen at public hospitals every day.
I could be able to clarify that after 7. But let me just say to you, the disruptions that are taking place could actually be related to that type of a situation that we are raising. When we have healthcare workers who want to get into hospitals and are prevented by tires burning into the gates, and actually some of them being beaten up. And I'm very delighted when I saw the statement released by another trade union called SATU. When you actually have, say, you have a right to strike, a right to respect those who don't want to participate in the strike. And further on, you have a right to protect and prevent you actually stopping patients to access facilities. That is ridiculous and actually bordering on being barbaric. And therefore, we need to actually be able to deal with that situation very strongly. I protect my right to strike, but I give space to those who do not want to strike, and also give real reason. Why is the strike focusing on hospitals? How workers are all over many government departments, but this is about hospitals burning tires, preventing patients to really access clinics and hospitals, getting ICU not to function. No, we're not going to succumb to that. The law will apply. And firstly, we are delighted that 5 of the 9 provinces have got successfully applied and got the court orders to stop this ridiculous behavior in our public space and allow specifically our own staff who want to come back and work, not to be prevented. Number 2, staff members and also patients who also want to access facilities, not to be threatened and have an access. So if the threat is to be actually understood, I hear before this we were saying there is a threat from the minister, a verbal threat by saying this and that will happen to the workers. There's also a physical threat and also interference of our own staff members who want to come in. That part is what we really condemn strongly. We need to respect all people, including those who want to strike, but also give respect to people who do not want to get into a strike.
Okay, so let me ask you then about what you were talking about as far as the conduct of the striking workers. Nehawu, I'm sure you've seen in some of the reporting union leaders saying that there have been isolated incidents of violence and intimidation. It's been exaggerated, some claiming that it wasn't Nehawu members who were involved in some of these actions. How do you respond to that?
We don't know that. All we know is that when they started their strike, tires started to burn in front of the gates of hospitals. Some staff members were actually not being allowed to get into there. Some of the staff members were taken out of the wards. Now, they may not be their members, but it happened during the time they called. They have to explain to us who was pulling out some staff members from ICUs, from high care, who was burning tires in front of the gates. Care workers who want to access and get in to do the work. So, yes, fair enough, it may be not their members, it may be their friends of Nehawu or whoever saw an opportunity to do it, they are doing it, but they are doing it in the name of Nehawu and in support of Nehawu. For us, it's neither here nor there to say it's not their members. It happened during the time that Nehawu has gone out on a strike.
Can you confirm how widespread incidents were? I was looking at one report that said there were cases where people believed to be protesting Nehawu members or their supporters, as you were just suggesting might be the case, gained access basically and got into wards and basically interfered with the work of health workers who had reported for duty. Has that been something that's happened in multiple locations?
Yeah, but Tembekile, why don't you wait and give, or why are you pushing for something that I've said to you? We are getting the national report at 7 o'clock by each and every MEC, each and every provincial head of department, giving us a rundown. I may be speculating, saying so much has happened I know for a fact that there were challenges that took place at Doranginza Hospital, but I can't confirm. Same thing happened at Springbok Hospital in Northern Cape. But I also want to know that, yes, what the minister was talking about, as Charlotte Macleck has ceased and all that. So the report comprehensively is going to be at 7 o'clock going forward for all provinces, all MECs and all HODs in the meeting that the minister has already urgently convened.
So in this meeting, Dr. Dhlomo, as you were just telling us, you're going to be receiving reports from the various MECs from all 9 provinces to tell you how the day has gone, perhaps today, and sum up perhaps some of the events from the rest of the week. You were also saying you will then talk further in detail about the investigation into those deaths. What else is on the agenda?
What will be on the agenda is to send a message of thanks to the SAPS for the support that they've given to us, because yes, there were incidents of violence and threats, and the police were able to assist us to intervene in various hospitals all over the country. Since yesterday, 2 days before, we have been in touch, myself with the minister in charge, the provincial commissioners. We thank them profusely under the leadership of the National Commissioner and the Minister of Health and Minister of Police, who have really supported us in dealing and quelling the issues that are there. So main agenda item is to receive provincial reports that will then give a national picture. But I can actually indicate to you that reports that we are already getting preliminary is that situation that has prevailed over the past 2 days is actually have been dealt with and is reversing itself, also supported by the police, and our senior managers all over are actually dispersed to be in various key hospitals, because there are specific hospitals that now is targeting. There are senior managers they were able to then report on time, and as soon as they report, we then be able to on time get and request the support of the police to deal with those incidents.
And I appreciate, as you were saying, on the issue of the deaths, that you're going to discuss it in detail today. Will you also start to ask questions about what to do if indeed a link is confirmed between the strike action and those fatalities, i.e. who to take action against if indeed it can be proven that there is a link? Is that something that you think should come up in these discussions?
I would imagine that would probably come up in the discussion and will be guided by the minister in that regard, yes.
And there was also mention of possibly bringing in military health services to assist in areas where, as expected, there would have been shortages of health workers, etc. Are you able to give us an idea of when that might happen and where it might happen first?
We have been noticing that some areas where we have in the past 2 days have difficulties in entry, accessing hospitals, that today has since improved. And therefore, that which already the minister was talking about, getting support from the South African Military Health Services to come and support us, is on hold until we can really be able to get reports today, this evening. It may as well be very sporadic. It may be to be that province, that hospital, but based on the report that we are going to get. But that also has already been activated by our minister, and it is put on a hold today for now until we get an update as to where are the pressure points, if they are, going forward.
And to what extent has security now been beefed up? I know you were saying you were going to thank the police service for coming to your aid in some of these cases, but as much as the department had been anticipating that there would be a strike, because Nehawu said even after government had obtained an interdict that it would proceed with the industrial action, but there was this lapse in security, as we've heard in various cases. How much help will you now get to boost the security response?
Thembekile, if I were to withdraw my labor power for this and that, and I do that peacefully, we do not need to have a security to guard you, because you have actually are doing as what they were alleging that they are doing. They are doing pickets and they are quiet and they are peaceful, which never actually appeared to be like that. You don't then have to beef up in terms of security. But if you then find a situation that we did find in many other areas where there's violent interference with the property, with the staff, then you need to really beef up. Unfortunately, I will not discuss at length with you security measures that are in place. Safe to mention that we have dispatched our senior managers to be in those key strategic hospitals so that we can be alerted if there's a need to beef up of what would have been put on the ground in those various areas. But we are actually not avoiding, we are not sort of preventing people to go on a peaceful protest and a peaceful picketing, but once it tends to be violent, then it actually is a cause of concern. And I'm very glad you played that clip by the president, who has just mentioned that in his address this afternoon when we're in Parliament, to say we cannot allow, we condemn strongly people who have a right to strike, but think that other people do not have a right not to strike.
Would it be mainly private security companies that are now called on to assist?
I have mentioned to Thembekile that I would hope you will not persuade me to discuss at length the security measures that we are putting in our hospitals, and then I would really plead that we leave it at that part, at least in as far as the issues of security.
Well, I'm asking, Dr. Dhlomo, not because we want to give away your security plan in detail. I'm asking if you're going to rely mainly on the help of private security companies. Do you have an overall number, for instance, of manpower that you'll need? I'm not asking for how many will be deployed, for example, at Charlotte Maxeke or at which point in each facility. I'm trying to get a holistic view because many of our viewers rely on public services and would want to know that when they are admitted or have a loved one admitted, there is sufficient protection while all of this is ongoing, sir.
We do have security services in all our hospitals. And when the issue became a bit abnormal, Thembekile, we then requested a beef up of the police, and they did. And they are already, some of them they are still on standby. Some of them are still physically available. I've even indicated to you again that there is a contingency of the security support from the army in the event the situation does not improve. So we do have a plan. We may activate it as and when and beef it up and strengthen it as and when we do find a need to do that. But I'm saying the plan is put in place strongly so because not all of us anticipated that people will start disrespecting the life of other citizens and the life of patients and participate in the strike in such a way that it compromises the lives of other people. And yet we have seen that happening. So there has been a need for us to beef up, to strengthen the security, firstly of our forces that we do have employed, and number two, strengthen with the presence and support of the police that I've mentioned, and also have a contingency plan of the army in waiting in the event we need that type of a support going forward.
Dr. Sibongiseni Dhlomo, Deputy Minister for Health. Let's leave you to prepare for that, that meeting that you're going to be having as a department with the various health MECs to talk about the strike action that's currently ongoing at public hospitals. For now, thank you very much for your time, sir.